Welcome. You made it. We're here, Philadelphia, right? Round of applause for getting here and joining us. Great. As Ashley said, I'm Angela Fontes. I have the honor and privilege of overseeing our policy and research work here at FHN. And I want to give you a bit of a state of financial health in the country, what we saw over the past year in terms of how we're doing. First, though, I also just want to acknowledge our sponsors, our funders here. And these are folks that not only help us make the investment in the research, but these are folks who are our thought partners and who we really rely on to be sort of our ears and eyes in the community. And so I just want to thank the City and Principal Foundations for our partnership on the Pulse project and for Prudential for the partnership on the Spend Report. I also want to make sure I acknowledge the people that actually did this research. So this is my policy and research team, and these are folks who really co-authored these two pieces of research that I'm going to talk about today. I just get to talk about it, but these are the folks actually doing the work. All right, so about a year ago, we were in LA. Who was there? Quite a few people were there. And when we really got into it to talk about what's going on with financial health, unfortunately, we reported that for the first time in 4 years since we've been measuring financial health, we saw a decline in financial health. And specifically, we saw a decrease in the proportion of Americans who are financially healthy. Unfortunately, we have continued to have tumultuous times, sort of filled with contradictions. So at the same time, we are hearing about record low unemployment, 50-year low in unemployment right now. We're also seeing media around mass layoffs, maybe affecting friends and family. At the same time that we see record high earnings being reported, we're still battling high inflation and high interest rates. So the team and I were really intrigued to see what's going to happen to financial health in this country based on all of these contradictions and what we're seeing. Well, if you attended my colleague Kennan's presentation at the member exclusive event, you'll know that we have bad news to report. So this year, we saw financial health decline, and specifically, we saw the proportion of financially vulnerable households increase to 17%. If you look at the numbers between 2018 and 2023, you'll see they look quite similar. And the 17% of the US population translates into 43 million people who are financially struggling with almost all aspects of their financial lives. You know, as a researcher and a scientist, I have to come to the data in an objective way and really let the data tell the story. And so it's easy for me to forget about who these folks really are. So I wanted to take just a second and talk about this term, financially vulnerable. These are families who are often experiencing chronic, overwhelming debt. And we'll come back to this idea of debt in a minute. These are folks really just trying to make ends meet. And things like saving for emergencies or retirement are not even on their radar. These are folks who may not have health or property insurance, even as we're seeing the increase in natural disasters happening. These are folks who are worrying about how to pay for winter coats or what they're going to do if they have a tire blowout. So that's who we're talking about. Because we're an organization not only committed to deep research, but also to action based on those insights, we have to go further than this 17%. And the place we generally start is with the who. So that was our first question. Who are the folks who are financially struggling? Are they certain groups, all Americans? And to our concern, but not surprise, we see that the decline in financial health is really concentrated among historically marginalized communities, specifically our Black and Latinx communities, is where we're seeing the steepest increases in the proportion of households who are financially vulnerable. This is certainly concerning on its face, but what we know is that this decline in financial health is going to widen already existing financial health gaps based on race and ethnic identity. This is certainly deeply disturbing and indication we have a long way to go in terms of financial health and equity in financial health. So we answer the who question. Our next question is the what. And if you use the financial health score, which I hope all of you do, this should look like this should be very familiar to you. So we conceptualize financial health as 4 pillars, right? Spend, save, borrow, and plan. Under those 4 pillars of financial health, we ask 2 questions each in our survey. And then we use those questions to calculate a score and categorize people into financially vulnerable, coping, or healthy. We also use this data to help us prioritize and understand where we might need to dig in for the next year. And so when we went to these 8 questions to really figure out where do we need to focus our time, where are we seeing some patterns around financial health, and why might we be seeing the declines that we did, specifically for Black and Latinx households, 2 patterns emerged. One, we saw that the proportion of households who said, my household plans ahead financially, decreased for Black and Latinx households. Fewer people were feeling like they were able to plan ahead, or they knew what the road to retirement might look like. We also saw a decrease in the proportion of households who said they have manageable amounts of debt. Again, we see this in our Black and Latinx communities and not in other race and ethnic identity groups. These are folks who potentially are sitting down figuring out which bill to pay because their income that month just isn't going to cover everything. In fact, 2 out of every 5 consumers who are Black and Latinx are really struggling in a way that we have to address. We were intrigued by this question around debt, and so we dug in a little bit more. We have the Pulse data that we use to develop our trends report every year, but we also have a second survey, the Spend survey, that goes out. So when we looked at why we might see these issues around debt manageability, what we found is that when calculated as a proportion of household income, Black families were on average spending 7% of their income on non-mortgage interest and fees. Compare that to white households who on average were spending 3%. This is reflective of a record $347 billion in this country spent on non-mortgage interest and fees. So up quite a bit. We continue to dig in. Why are we seeing this? Well, part of that may be related to credit card use. And so when we looked at specifically credit card use, we see one, there's an increase. So $93.2 billion were spent on credit card interest and fees last year by consumers. That went up $20 billion this past year. And we know that Black and Latinx consumers are more likely to carry a credit card balance. In fact, according to our data, while fewer than 50% of white households carry credit card balances, 3/4, or 72% of Black households, and 2/3, 66% of Latinx households are carrying balances. This increase is certainly due to a number of factors. We see both higher balances being carried among consumers, but also higher interest rates that are reflective of the economic times we're in. And I want to be clear, credit cards and debt are a hard one because we know it's critically important that households have access to affordable, low-cost credit options. And I also want to be clear that often this credit card debt is not the result of excessive spending. I think it's easy for us to say, oh, well, folks might just need to spend less. This is not the result of, as my dad would say, champagne tastes on a beer budget, right? These are families just trying to get by. These are families who had an unexpected expense and just need to cover that to get through. So when we dug into how households might be accessing low-cost credit alternatives, one of the things that was additionally concerning is that there does seem to be some access issues. Every year we look at 4 categories of alternative financial services. And so these are services that are generally higher cost and sometimes predatory. And we use this as an indicator as to whether households are getting this access to credit that they need. For all 4 of the categories of alternative financial services that we track, we saw an increase in the use among Black households. And for 2 of the 4, we saw an increase in the use among Latinx households. So, in sum, the state of financial health is worrisome. This decline is concerning. This is really driven by increases in the proportion of financially vulnerable Black and Latinx families. And so it's critical that we continue research to better understand the financial pressures and realities these families are facing. It's also important that we think about innovations and expansions of low-cost credit alternatives. That certainly came up in our data this year as an area where we could use some increased focus. Finally, we need to continue to focus on equitable access to financial services across the system. And to me, these data suggest we have a long way to go to equity in our financial services system. So that's the bad news. The good news is that this research is the start of the conversation, not the end, right? You all are here to continue that conversation. We have done this before. So for 4 years, through a pandemic, we saw year-over-year increases in financial health. And so we know this can be done. We just have to figure out how. So I'll end by just inviting you to spend the next couple of days with us in community, really creating the roadmap and action plan for increased financial health for all. Thanks. So to continue the conversation, I want to invite my colleagues, Kristen and Adib, to come up and join me.
Good afternoon, everyone. We're starting with this topic today for Emerge, this topic on data and insights and research, because as you go through the sessions tomorrow, we want the discussions to be grounded in the reality of what's happening to families and their financial lives today. We're starting with this topic because if we are to improve financial health for all, which is our mission, we must focus on specific populations that are not well served today. And we're starting with this topic because throughout today in the networking sessions at dinner and tomorrow, as you all are contemplating, what does this mean for my work? What does this mean for how my organization engages in financial health? We want that to be informed by the research and the insights. So Kristen, I'm going to start off with you. And what I'd like to do is actually to take us back a few years. The data from Pulse is widely used by practitioners and policymakers. And we are so appreciative of the Citi Foundation's support of what is a public good. I'm curious to hear, going back when the foundation decided to support this public good. What was your motivation? Why did you feel like it would be important to have this resource be available for practitioners, researchers, and policymakers?
Well, I would say first and foremost, this represents a continuity of work and partnership between Citi Foundation and FHN. We've been longtime supporters of FHN, going back to when your old acronym was CFSI, which I don't quite remember what it stood for anymore. But working for a corporate foundation related to a bank, we have a long-term commitment to financial literacy education, and can remember the days when the state of the art in sort of measuring the success of a financial literacy program was whether or not a person took all 8 classes and passed the test. And there was no back-end measure on whether or not they increased their savings, reduced their debt, changed their behaviors, built their credit score. And it was really a forging partnership with CFSI then and FHN now on really building out that field of financial capability. And we've, along the way, partnered on many different innovations of how to pursue behavioral economics and nudge behaviors to try and help people own their financial health. And the time that I joined Citi, we were pioneering with you on a program called the Financial Health Diaries, which was so eye-opening for me when I first joined the foundation, because my perspective on financial literacy education was those 8 classes and 1 test. And all of a sudden, it was an eye-opening opportunity to look at people's full financial health and understand their financial health from a cash flow perspective. I think that we historically look at it from a balance sheet perspective, and on an annual basis, people look okay. They own a car, they maybe own their home, they send their kids to school, and they're able to cover their costs on an annual basis. And it was that research with the Financial Health Diaries that really showed us that several months of a year, the average American family is underwater. And it gave us an opportunity to realize that we need to do so much more research to understand how these families stitch their financial lives together. Is it bartering? Is it relying on family? Is it using various loan products or credit products? So I think that's sort of the history of our relationship. And when we had the opportunity to continue to help and support the Trends Report, we jumped at the opportunity because I think there is so much unknown about how American families do stitch their financial health together. And it's so important for us to rely on data and facts so that we can speak in the real world and not rely on stereotypes or perception.
I'm glad you mentioned that, because often in order to make systemic change, we have to sometimes unlearn some things, and we have to change mental models. And your example of whether we're thinking about balance sheet or cash flows, right? That change in mental model was important, and the data can help you do that. Angela, let me ask you, you shared with the audience what we're seeing in the data. When you think about how the data is being used, what are you seeing in terms of practitioners or policymakers? How are they using the data that you've seen, and what's the community asking for more of?
Yeah, so I think what's exciting is we have had good utilization of our data among industry, and we always want more. We always want people using more data. But since I've been at FHN about 1.5 years now, it's been really exciting to see that it's not a community, it's multiple communities. And so as we think about how to really push systems change, the fact that the data are being utilized by policymakers, the fact that the data are being utilized by academics, and we're really seeing sort of amplification of the data and research is incredibly exciting. At the same time, it's important to us to have feedback loops. And so one of the things we rely on our partners to help us with is to hear what the folks who are really working with boots on the ground need in terms of data and insights. And our ability to sort of incorporate that is entirely dependent on our partnerships. So that's an important point.
Kristen, when you think about the Citi Foundation's philanthropic strategies, how has Pulse helped to inform where the foundation is seeing the key consumer needs and what you're doing in your grant making?
I think it really feeds into everything that we're looking at. This past week we announced a global RFP on food security. And we've traditionally focused on sort of housing and small business development, and not necessarily focused on safety net issues. But as Angela's presentation showed, more and more people are financially vulnerable and just trying to meet those basic needs of their families. So yeah, I never thought that we would end up doing a global challenge on food security, but it is. We just put out $25 million this week, and it's going to have incredible impact and help a lot of families. I think it also has us sort of step back and think about it as an ecosystem. We generally try to take a systems change approach to our work, and I think at this point, with you, FHN, celebrating its 20th anniversary, I think it's really time for us to take a step back and think about what the field of financial health and capability has accomplished over the last 20 years, and what will the next agenda be? What are the next innovations coming down the pike, and how can we, as an industry, philanthropy, and corporate America, help support those innovations to promote financial health in America?
In the RFP that you've issued for food security, are you explicitly thinking about the link between financial health and food security? And if so, how are you anticipating that to play out?
Yes, absolutely. So it was a watershed moment for us. It was the first time we did a global challenge. So we had over 1,000 applications from 82 countries around the world. But the ones in the United States were very much focused on financial health. They're clustered around help for entrepreneurs in the food business, as well as financial systems and capability of how people access food in their local community, whether that be through farmers markets using SNAP and other benefits, and helping the financial process or the financial transaction work better for families.
And that's such a great reminder that while the financial services industry is such a key player in people's financial health, it's not only about the financial services industry or the financial services sector. All of these other sectors, whether it's health, higher education, housing, and food security, all affect people's financial health.
Absolutely.
So that's a great example. Angela, what can we look forward to in terms of what's coming next in research and insights from FHN?
Yeah. So as Kristen mentioned, we're coming up on 20 years of looking at and supporting increased financial health. And so one of the things we have teed up is a new look at our score. And while the score has been incredibly beneficial and useful in terms of how we think about financial health and tracking financial health over time, times change. There was a whole conversation about AI, right? How do we think about AI in terms of how we're measuring financial health? And so we'll be kicking off a good hard look at our score and potentially some changes in how we think about that. That work continues Citi's amazing support of our work on financial health, and they have generously funded that work as well. So that's one thing, but I think also this ability to produce really timely research on kind of hot topics is something we're going to be looking at over the next year. So we had a couple of pieces that we released on student loans. We had a piece recently on natural disasters. And we really want to be at the frontier of what might be impacting financial health, both from a consumer behavior perspective, but also from what's happening in the macro environment. We have a piece on inflation coming out in the next couple months. And again, this idea of there's a lot happening, and all of that is impacting consumers and financial health. So we're going to be looking to those new tough topics as we think about work for next year.
And Angela, I wonder if you would share a little bit about, you mentioned that we are thinking about the current score and how that might evolve. Are you thinking about ways of engaging the community, or you said communities because there are multiple communities
Absolutely.
in that process?
Absolutely. And so part of the strategy there is to really hear from you. What's working? What's not working? What are the questions we ask in the survey that have been most helpful to you? Where do you feel like we have an opportunity to maybe tighten up something, right? And so look for invitations certainly to all of our networks, to have some listening sessions as we want to hear, how do we make this a better score for you, a more usable score to support financial health?
Let me ask you both this question about corporate philanthropies in general, corporate foundations and community-based organizations. What are your thoughts in terms of how both funders and community organizations can better use the data that we're coming up with, whether it's the national study or some of the studies that we're coming out with during the year? What thoughts do you have there? Kristen, I can start with you.
Sure. Well, last week I was speaking with a group of cities that were focused on supporting entrepreneurship. And the big topic in the room was capital access and the inability for entrepreneurs of color to access that first loan and looking for alternative sources of credit. And so I think that being able to access this research enables them to better understand the credit profile and the larger ecosystem that entrepreneurs are working in, and how they can bring to the table the various programs that a municipal government has within its toolbox, whether that's from licensing to permitting to providing grants and technical assistance on the ground. And again, I think that just sort of goes to the ecosystem approach, is that we all are in this together, and so corporate philanthropy has a role to play, but we work in partnership with nonprofits, we work in partnership with local government, and we work in partnership with industry, and we all need to bring our best efforts to the table to find solutions.
Yeah.
What about you, Angela?
Yeah, I think certainly there's a role of funding, and that's critically important. This type of research is really an investment, and so it is important on that, from that perspective. But I think what's exciting about our funders is that they act as connectors for us. And I mentioned how important it is for us to really have access to and be able to communicate with folks with boots on the ground, right? Folks who are in the communities, who are working in the banks, who want to make a difference. And that feedback loop is so critical. And we have incredible funders who both support the work financially, but also put us in contact with different organizations, different community groups that we can both promote the use of the data and research, but also hear and listen to what is needed as we move forward.
Yeah, we actually have Angela and Kenan delivering some webinars next week with a group of nonprofits on the ground, and we've done this once before, and I think the most powerful thing is actors on the ground, they live it every day and they intuitively know what we're all experiencing, but having access to the reports and the data helps them validate what their clients are experiencing and put a name to it and provide it in a broader context, and helps them sort of think outside the box of how we can find solutions and find unusual partners to try and make things better.
Kristen, share a little bit more about how that came about. Are you hearing a demand from your other grantees of, hey, do you have resources or partners who you could bring in to talk about the data? Or is this something you as a funder is saying, hey, I need to make connections between my different grantees? Is it both? How did that
Yeah, I'd
come
say
about?
it's a combination of both. I think that our nonprofit partners are always eager for exposure to best practices and knowledge and research, because they're on the ground every day, and sometimes they don't take the time to look up and understand the context of their work. And I think that we learn a lot from them, and I think they've been a fantastic feedback loop for this survey. And that I think from a funder's perspective, we're constantly looking for synergies of how our programming and our grantee partners can learn from each other and make new connections. So it's a little bit of both.
I have as you both were speaking, I had a question come up in my mind. So this is not in the script. That's what you get for having me as a moderator. I live in Maryland, in the DC area. I took the train up today, and I happened to be sitting next to a mental health professional. And she was talking about how whether a message gets through to someone or not, doesn't matter what data you're using. It depends initially on whether they feel a connection, what they feel insight and their reactions to whoever is giving you the message. And if that doesn't go well, then data stories don't matter a whole lot. And Angela, you and I have talked about how when we say data, data is both numbers, but it's also stories.
Yeah.
Stories make up data as well. I wonder if either of you have thoughts on, as we try to change practices and mental models with stories and with data, what's the right combination in which we should bring it, and what's the right framing with which we should bring it? Because if people tune out at the beginning, then it doesn't matter what we're bringing.
Well, I would say that was a real win for the financial diaries, in that it provided a lot of human context and the lived experience of what a low credit score can mean to an individual family. And I think that's something that we consistently try to bring to our work, try and bring up user profiles and share those stories of impact. In terms of the survey, I don't know, have you guys pursued that?
Yeah, it's something we're just starting to explore, and we did a couple of studies as part of Pulse where we did pull in some really strong sort of stories. Our recent release of the report on individuals with disabilities was a good example, where we interviewed some folks and were able to pull quotes and really tell those stories with some amazing photography. And so I think this is something that for us is sort of a continued evolution of how we bring sort of the face to the research, right? In behavioral science, we'd call it the halo effect. And while I think I'm compelling and awesome for everyone to listen to, I also acknowledge that I may not be the right person to deliver some of these messages. And so how do we make sure we're really reflecting and listening to and putting a face on the research, particularly if we are studying communities that might not look like me?
The data that, Angela, you presented, it's sobering. And it's sometimes easy to feel like, wow, what do we do in the face of the trends going in the opposite direction of what we want it to? What are some glimmers of hope? What are you energized about, hopeful about? Are there solutions that you've seen that are working, or ideas that you're thinking about maybe hasn't been put into practice?
I can start. So I think, unfortunately, what often happens is we sort of have to hit a bit of a bottom, right? And my sincere hope is that we're there. I think what is going to be required for us to really make progress on financial health is deep cross-sector collaboration and systems change. And so while Financial Health Network has worked specifically with industry to make changes, I think we're entering a new era where we need industry partners, we need our policymakers, we need our philanthropy organizations, we need academics, we need the research community. We really need everyone, and I'm hopeful that we're just starting sort of a new era where we're going to continue to see more and more of that collaboration across sectors.
Great, and I have a perfect example. I think somewhere in the room is one of my partners, Justine Peterson from St. Louis. They are in the midst of implementing a pilot, partnering with CDFIs who are doing microfinance and small business lending to BIPOC businesses, and we're partnering with Experian to give individual borrowers access to their full credit profile of the full 8 points that go into making their score. And along the way, they're working with their financial counselor, and they're able to see when they make a certain payment or they do a certain financial action, how that ripples across their financial credit score on a real-time basis. And we're at the very beginning stages of the pilot, but I think what's so exciting is the partnership with the CDFIs, who are then in turn, I'm not sure if everyone knows, Community Development Financial Institution or a microloan fund, who are then making credit available and helping the small business build credit. And so I think that over 80 or 90% of the users in the pilot so far are BIPOC, and early days showing good progress. So Sherry, I don't know if you're in the room, you want to raise your hand. I'm pretty sure she was going to be here. But if not, people can look her up and learn more about the project.
Great, thanks for sharing that. We have time for questions, and we want this to be a dialogue. So please raise your hand. We've got colleagues with mics. And your questions for Angela or Kristen. And this can be both about the panel, but also any of the insights and data Angela was sharing before.
I think everyone wants to go have a cocktail.
Not just yet, folks. I'm Mike. I will be walking around with a mic for when you raise your hand.
I'm curious to hear how you all in the room, how you've been using the Pulse data and what you found useful. Is there a question there?
This is Bob Hunt from the Philadelphia Federal Reserve Bank. Question about one of your figures, the manageable debt. Are you able to correlate that with changes in income and in spending on essentials?
Yeah, that's a great question. We certainly can examine the relationship between manageable debt and income. And the trends report is available. And I'm not sure we have something specific on that in there, but we certainly have the capacity to do that. The question around essential spending is a little tougher. First, you have to define what essential spending might look like for a household, and then we have to think about differences in geography and how that might impact what's essential. So that one's a little bit trickier to sort of figure out, and I'm not sure with our current data we have that ability. Now, I think one of the things we're working very hard on is to try to figure out how we can utilize additional data sources. So many of you all are sitting on incredible troves of data, whether that be transaction level data, whether it be credit data. And so we're focused on not only thinking about our financial health measure from the survey perspective that we have historically used for measuring of financial health, but how might we use transaction data? How might we leverage credit bureau data to inform what we see in terms of financial health? And so we don't have that solved yet, but it's certainly something we would love to continue to think about.
See one here, one over here.
Hi, my name is Rena Johnson. I am from Patelco Credit Union in California. My question is in regard, so we use your data. It was back when I started 7 years ago, we had just sort of revamped our brand and our business model and went to more of a financial health business model. So it's really helped to set a strong foundation for us, which has been awesome. But my question for you is, with the data that you have and the reporting that you're presenting, do you do it based on regional data? Like, can you look at, let's say, California, given the high cost of living there, and do you see it, increase or decrease, or just consistent with the averages that you've been sharing today?
Yeah, so this is a question we get pretty frequently. How sort of finite can we look at our data? So we leverage a national probability-based online panel to field our survey every year. And this year we fielded to the largest sample since we started measuring. So around 7,000 households responded to our survey. In the trends report, we do break it down by census region, and so I think that's available. But it gets tricky when we start to think about state level data, because we just don't have the statistical power to do some of the comparisons, and we just don't have enough data to make concrete estimates around some of the populations. Now, California is one of the few states where we probably could do a little bit of digging. It's usually California, New York, and Illinois. Those are states where we often can and do have enough data to make some statements. So we'd love to talk with you after.
I see two hands here and then one in the back.
good, I'm first. So I have a couple of questions. They both relate to program impact and analysis, because I think, in the trajectory that we're studying, what you presented is fantastic, and it's always useful. And Patelco, I will say, I'm from Travis Credit Union, a neighbor, and they are fantastic using this data. But what about the program and impact analysis from what you're presenting? For example, when you say that Black and Latinx households carry more credit card debt and lending debt and predatory lending debt, where are the programs also possibly in the potential in the future to say, here are the programs that were implemented to change this number and here's some of the impacts, so that we can see the whole trajectory, right? We want to create that, I believe, what is the saying? Great data and actionable presentation, but that part of it.
Yeah. So I think you're asking, do we have the ability in the data to think about what programs might be effective in making change?
To those numbers in the data presented.
Yeah, and that's, again, it gets challenging, right? Because there are so many folks working on this issue, and our data are generally national level. Now, we have started to think about how to add, right? Like, I think your question, my answer is sort of a yes and. So we have the Pulse data, it's critically important, we use it for benchmarking at the national level, but also, I think we're starting to really think about how do we support organizations in doing program evaluation, in really thinking about how a specific project, a specific program might be impacting at a local level what financial health looks like. It also helps that one of the courses I teach at Northwestern is a graduate course on program evaluation and public policy. So I'm deeply invested in this work.
The follow-on really quickly is about CDFI.
Yeah.
And how this data could be layered in as we go through what I think many of us in the room are on tenterhooks about, the new standards for data, where they layer in geography, they layer in the Latinx, they layer in target markets as well. How could Financial Health Network possibly partner with the CDFI fund or with CDFIs to help us in that kind of financing those models and those impacts? Because that's exactly what they're trying to move as well, community development around these issues.
Yeah, I'm actually going to ask Kristen that question.
So an unrelated grant that we have, we actually funded the Carsey Center at the University of New Hampshire this year to establish the first ever CDFI research consortium. And so I think that, for a long time, CDFIs have been around, and that we rely on anecdotal evidence and stories of borrowers, and we have a lot of good feelings, and so do policymakers have a lot of good feelings about the CDFI industry being an effective economic development program that has created jobs, created homeowners, created small businesses, but we've actually never had the hard data to back it up. And we haven't had data from, or studies done by academic researchers from community to do that. So we provided seed money this year for them to establish the first ever CDFI research consortium. They put out an RFP, and I think they received about 40 proposals, and they they just selected the first 12. It hasn't been announced yet. They'll be announced in the next month. But again, this is a first step, and this is the first round. The plan is that they will be doing an annual call for research. Not only do they want to work with individual researchers that have their own research ideas, they're also willing to make marriages between CDFIs and academic researchers across the country. And I think we're also really interested in making marriages with local universities and local business schools that aren't necessarily aware of the CDFI field broadly. So we're really, really excited about this, and we think it's a good step in the future.
Here.
You can see right behind me there. Question for you on the, I guess it's mostly for Angela, but I'm curious in your data how you're representing the fees associated with all the plethora of different lending products like buy now, pay later and installment loans. Does that show up under credit card fees, or is it showing up under other fees? And then separately, I'm also curious, is the data getting harder for you to to understand because of the way that consumers are now holding multiple checking accounts and wallets, and I could just imagine that it's not as easy as it used to be 5, 6, 10 years ago. That's my question.
Yeah. So as the financial services landscape continues to evolve, it makes our job much harder to figure out how we categorize things, how we classify things. Are we accurately capturing the full picture of a household's financial life? To your specific question about BNPL and whether that counts as credit card debt, I believe we look at BNPL separate from credit card debt. I don't think it's part of that calculation. But yeah, it's every year we sit down with the survey that's fielded as part of Spend and have to think about what came up this year that we didn't see last year that folks are using in ways that we hadn't anticipated, and maybe even the financial service providers who are offering these did not expect. And that's part of the challenge, but it's also part of the exciting innovation we want to continue to encourage for consumer benefit.
I see a hand here.
Hello, I'm Paul Quintero with Ascendus, speaking to CDFIs. This question is actually a practical one, so it may not just go to the panel, but to everyone. We're new in using this tool, and we'll be using it for all our clients going forward. So we'll have 100% coverage the first time. My question is, we're looking to do this longitudinally over the life of a loan, so I have, let's say, 5 years. How have others ensured that you go from 100% to, I know it's not going to be 100, but something as close as possible? So being new, asking for advice, best practices, how do you keep that longitudinal momentum going?
Yeah, so I promised the event staff I wouldn't get too technical in my presentation, but we would love to talk with you about that and think through ways to support your research. I think that's one of the exciting things that my team gets to do on a regular basis is we certainly feel like we have research questions we want answered, but this is a group of just incredibly talented folks at statistics. I come from a survey background. We have folks really talented in qual. And so the extent to which you as members can benefit from our just answering a quick question, we're always excited to talk with the membership. So I'd love to talk with you more. Yeah.
I'm also very glad, sir, that you looked around the room and asked for advice. That's a big part of why we bring this community together,
Absolutely.
to share and exchange ideas and learn from and with each other.
Yeah.
Was there one other hand I saw over here?
All right, is that better? Okay, there we go. I'm Anthony Barr. I'm with the National Bankers Association, represent MDIs. And a question that I had is going back to kind of the place-based aspects. I know that there's limitations in being able to tell that story, but I think thinking about the income flows on a monthly basis and what the job quality is that affects that. I was just curious if you are thinking of other data sets that you can kind of pull in to start to tell a story about how much of the year-to-year changes in economic mobility can be tied to job stratification or changes in the labor market.
Yeah, that's a great question. And if you were with us last year, a good part of the conversation we had around trends, around the Pulse data, was related to jobs. And we've seen such change in the way folks are thinking about work and earning income. And so that continues to be a consideration for us. But again, that's an area where just keeping abreast of all of the changes that are happening it's a full-time job for us. Gig work versus small business ownership is something we're incredibly interested in better understanding how that kind of income impacts financial health. But it certainly is an area we will continue to do more and more research. I think there's a few tables in the trends report, but that is small business in particular is a super hot topic for us.
We're going to have to close this session for now. Kristen and Angela are around, so please, if you have additional questions or ideas, bring it bring them to them. If you haven't yet, please go to our website and spend time with this data that we've been talking about from both the Pulse and the Spend studies. And I encourage you to reflect on what this data means for your work. What are the implications? When you're making the case for why financial health is important, use the data and the stories. When you're informing practices at your organization, ground your decisions in the research. And bring your ideas to us. What other kinds of data or analysis or insights would you find most useful in making the case and in changing your practices? If you are wanting to deploy this methodology with your employees or with your customers, please come and speak with us. Kristen, thank you for the catalytic role that you've played and continue to play as a funder in making it possible to have resources such as the Pulse available for the field and for everyone to use. And Angela, thank you for your leadership in bringing research and insights to the field to inform practice and policy. Please join me in thanking our panel.
Thanks.